Kid gets fed 3 square meals a day at school.
I missed that.
All right, I was going to say good evening, but it's still morning or afternoon somewhere. So good afternoon. Welcome to our diversity dialogue, Disparities in Domestic Violence, Sexual Assault, and Substance Use Incidences. We're just going to spend a quick few minutes just going over a little diversity dialogue group rules. To facilitate an open and honest discussion, we abide by these rules at each of our diversity sessions. Become humble in the name of learning. Be open to new ideas. Give everyone a chance to speak. One person talks, all listen. Attack the problem, not the person. Respect the confidentiality of the personal views and stories shared during this experience. We know that sometimes these topics can be a little touchy, a little sensitive, and so we just want to make sure that we have the right framework when we're having our open discussion. So, the diversity dialogues are brought to you in part by the YWCA Northeast Indiana Level Up Council. We believe that our community can only truly prosper when each member is accepted, supported, and valued. The YWCA Northeast Indiana is taking deliberate action to educate, empower, and unite people through programs designed to create inclusion and build racial equity. Our vision is to help our region become the equitable place we know it can be. It's time to level up Northeast Indiana. So some of our announcements are, we are grateful to work with wonderful partners in this community. The Sexual Assault Treatment Center, thank you. Drug and Alcohol Coalition, thank you for being a part of this diversity dialogue. In addition to the YWCA Northeast Indiana services, we service domestic violence, sexual assault, and substance abuse recovery. With that being said, I'm going to introduce our panel and we're going to kick it off. I'm Donna, the facilitator. That's me. We have Aisha Pearson, the Director of Residential Services. I'm just going to read their names and their title, and as we kick off questions, they'll be able to inform you more of what they do in the YWCA. And it went back to me. No. We have Emma Walker, who is our Sexual Violence Coordinator. We have Nunu, who is our advocate for the YWCA Northeast Indiana. We have Jennifer, who is our Director of Empowerment in the YWCA. We have Mary Claire Clark, who is the President and CEO of the Allen County Drug and Alcohol Consortium. At the end, we'll have moments for question and answers. But right now, I'm going to kick it to Ms. Jennifer.
Oh, okay.
Ms. Jennifer be the first person. Can you talk with us about how rates of experiencing the challenges you address in your work area differ for people who are Black, white, Latino X, Asian American, or for Indigenous people, and give us a little bit of information?
Sure. Hi, everyone. So I am Jennifer Rolfe, and I am a director at YWCA overseeing our survivor services, so the services we provide for victims and survivors of domestic and sexual violence. When it comes to the issue of domestic violence, the national statistics show that about 1 in 3 to 1 in 4 women overall will experience domestic violence throughout their lifetime. But we also know that domestic violence is one of the most underreported crimes that happen. So with any stats you hear today, we always need to understand that that's not showing the full picture. There's always a lot more that might be going on that we don't have reports of for various reasons that we'll be talking about this afternoon. When it comes to different racial and ethnic populations and what that domestic violence might look like, Within the Black community, we see about 45% of Black women will experience domestic violence throughout her lifetime. That is an extremely alarming rate. When it comes to Latinx populations, you see about 1 in 3 Latinx women will experience domestic violence throughout her lifetime. When it comes to our Burmese community, unfortunately, we don't have any national data, at least that I could find. If someone can help me out and pull one for me, let me know. Because of underreporting due to cultural beliefs about gender roles within relationships, due to the trauma of living in refugee camps and coming to a new country, there's a lot of layers that might add to why those numbers are going to be severely underreported. So we see disparity within different populations that are experiencing domestic violence, and then we'll talk more about what then those specifics are besides just the facts, the stats that we see. And then within our services at YWCA, we are definitely seeing higher rates within the individuals that are receiving our advocacy services. So within our programs, we've seen consistently that about 51% of our survivors are white, about 10% are Hispanic, 8% are Asian, 24% are Black, and 7% are multiracial. And so we're seeing, in comparison then to the city of Fort Wayne, a much higher portion of different marginalized populations within our services that are seeking out help and assistance as they navigate their relationship. Did I miss any populations?
Does anybody else want to chime in on this question?
Yeah, I would just like to say, as a part of that, because Jennifer gave statistics on all of our programming, with our residential program and those who are seeking shelter because they are displaced by the domestic violence, their domestic violence experience. We are seeing rates of about 55% of women of color who are seeking those services and being displaced by their experience. Within that, about 41% of them are African American women, and also about 67% of those are women with children. So when we look at that, we'll take a little deeper dive into that maybe later on, and some more questions about that and the generational aspects of that.
I can talk a little bit on the sexual violence piece. I'm Emma Walker. I use she, her pronouns. And as the sexual violence coordinator, I've helped oversee our programming for sexual assault, sex trafficking, and childhood sexual abuse. So when I use the term sexual violence, I just want everyone to know it's kind of an umbrella term for several different forms of victimization. So with that being said, here nationally speaking, there was a survey taken to see how many women reported being raped, what percentage of women, and that broke down to 18% of white women, 7% of Asian or Pacific Islander, 19% Black, 24% mixed, and 34% American Indian or Alaskan Native. And kind of as Jennifer was saying, if you compare that to our overall population statistics in the U.S., you'll notice that there immediately is a disproportion as far as our services here in Fort Wayne are considered. So you guys know kind of what the population breakdown, according to the 2021 census in Fort Wayne, 72% of our population is white, 15% is Black, 9.1% is Hispanic or Latino, 5% is Asian or Pacific Islander, and 5.1% is multi-racial. And then within the YWCA and our sexual violence program, so we're a pretty new program, we're less than a year old, so our statistics are pretty limited, but I am happy to say that according to our reports, we've helped 67 survivors, and of that, 13 identified as Black, which comes out to about 20%. So again, even if you're just looking on a local level, 15% makes up our entire Fort Wayne population of the Black community, and yet what we're seeing at the YWCA is 20% of the population that we're serving is identifying as Black. And so that kind of goes to show locally how there is also a disparity in this issue. As far as sex trafficking is concerned, 40% of all sex trafficking survivors identify as Black women. So again, that's marginally much higher. And I also think it is important to note here that when we're talking about sex trafficking and we're talking about perpetrators, it's also important to recognize the other side. So nationally, 57% of perpetrators are reported to be white men. And a 2012 research study showed that 85% of people who bought sex on the internet identified as white men. So there's also a disparity on kind of the other side of it, of who's purchasing or who is causing these crimes.
Thank you, guys. Miss Mary, I'm going to start this question off with you.
Sure.
What stigmas are faced by people experiencing the challenge areas you serve, and how might those be compounded by racism?
So a lot of the stigmas that are experienced with people that have substance use disorder are that substance use disorder is not recognized as a disease. And we know that alcoholism, substance use disorder, dependence on medications, those are all rooted in our brain functioning and the way that our brain interprets the intake of those drugs. So thinking of that as a medical process as opposed to a moral failing, essentially, is something we have to do to constantly combat the stigma that is placed upon people that have substance use disorder, alcohol use disorder, opioid use disorder, and all of the things. I say substance use disorder as a blanket term for pretty much any substance that is used to deregulate somebody's reality, break down anything that is occurring to them physically, emotionally. So when we look at that from the perspective of marginalized populations or individuals that are discriminated against, the trauma and the emotional and physical reaction to that trauma is higher for populations, obviously, that experience more trauma. So we want to look at always, when we're talking about individuals that have a substance use disorder, when we're working with the population, we want to make sure that we are working to combat the trauma aspect of that and to look at the medical disease process the same way we would with any other medical disease or disorder, because we know that that is more highly concentrated among populations that experience more trauma. We obviously need to make sure that we are privy to the trauma and to trauma-informed practices. I'm not sure if that really answers the question, but everything is compounded by the amount of trauma that we take in. And we know that based on our history and historical racism issues that we have within our country, that people of color, indigenous individuals, people that are immigrants and refugees have a higher propensity for trauma, and then therefore have more of an impact from substances and substance use disorder. So if we look at other marginalized populations and we look maybe at individuals seeking services for substance use disorder, and we look at individuals that are within the LGBTQIA plus population, that population has less access to shelter, to services, to affirming care, mental health and physical health care. And that's a population that's often overlooked when we're looking at populations that have an excessive amount of trauma placed upon them, and then also a lessened amount of resources. So it's kind of a double-edged sword with this particular population. Also individuals who are immigrants and refugees that may have a language barrier. English is maybe not their primary first language. We want to make sure that we have services that are inclusive and representative staff that can serve individuals within those communities. Earlier, I think Jennifer mentioned that we don't have a lot of data on some of the populations that we serve most frequently, which is something that's really difficult when we're dealing with substance use disorder or any of the different challenges that people face in the community, because that is then compounded by the fact that we don't have the providers to either provide that therapy or intervention or medical care within their first language.
Anybody else want any input on this question? What stigmas are faced?
A little bit of what was mentioned about the historical racism of, even if you look at so as a society, we already have challenges with the way we approach substance use, of viewing it as a choice versus a disease, and blaming individuals struggling with addiction for that rather than trying to get help and services. But then if you look at historical data, marginalized populations are often criminalized and are less likely to be provided resources for their recovery, are more likely to have higher rates of jail sentences for crack versus cocaine, and that is all rooted in racism. Mm-hmm. And so that historical trauma of the way that we view addiction in general, but then when you add that layer of the racial disparity of how different individuals have been treated when they are arrested for possession, and whether or not they're even provided services in the first place, will then lead to that long-term effects of, obviously, if you have generational addiction and then no one in the family getting services, you're going to see higher rates of ongoing addiction happening within that family, within that community.
I just want to speak to that as far as how that coincides with the experience of domestic violence. Oftentimes we see survivors who do have some the addiction, or experiencing some addictions, or are facing those challenges, that are afraid of reporting their domestic violence because of that stigma and the criminalization of their disease. And so coming forward also means coming forward and admitting that I am struggling with this, I have this disease, and possibly facing those criminal backlash. And so oftentimes with domestic violence being rooted in power and control, that is a key in abusers being able to control victims and withholding that over their head, things like that. So if we can remove the barrier of that stigma and that criminalization and work towards that, so that people do feel more comfortable with reporting and not facing those that criminal backlash, then we can help decrease that the experience of domestic violence for those marginalized communities or people who've experienced trauma going forward.
Yeah, we definitely see it in the sexual violence movement as well, especially in sex trafficking. There's a lot of stigma around sex work, sex trafficking, and then you add in racial components and race-based components, and it becomes a lot more tricky. There's actually a quote that the Urban Institute collected on one of their surveys, that traffickers readily admit they believe trafficking women would get them less jail time than trafficking white women if caught. And so that in part plays into why we see such a disproportion of black women being targeted in sex trafficking over white women. And then it also goes back to childhood. There's a lot of interesting reports now on the over-sexualization of black girls, underage young black girls. There's also a history of demonizing black women in our culture. And so it really starts from the point a child is born, that these stigmas begin to be placed against them that increase their probability of experiencing sexual violence at some point in their life.
And also our immigrant population, they don't want to share, even though they are victim of sexual assault, victim of domestic violence, because of stigma, and they have a lot of emotional abuse in the past, so they don't want to share. So we have to give most education at the community to get services from us.
And I'd say we also see it on the back half of it. So oftentimes when people are getting out of trafficking situations or out of a sexual assault, the very system that they're asking to be entered back into, being the criminal justice system, is a scary experience for a lot of our survivors. This is a system that they have been harmed by historically for 400 years in our nation. And so to ask them then to re-engage with that system is terrifying as well as very risky. 57.5% of all juvenile prostitution arrests in the United States are Black children. If you look at the way our laws are set up, those should all be seen as trafficking cases. However, they are then incarcerated for prostitution when they're not even at an age of consent. So I think that's really important to hit on, because it also shows that as people are survivors and are trying to be identified as survivors, they're being seen as people instead who have committed crimes and are being incarcerated. Sex trafficking, we see a lot of survivors incarcerated for theft, drug usage, prostitution, and violent crimes, essentially trying to protect themselves most of the time. But when we get in front of a court of law, it's frequently not seen that way, or the right questions aren't asked to figure out, okay, is this sex trafficking? There's just immediate assumptions made, and so a lot of people are incarcerated as a result.
So I know we talked a little bit about the stigma, and we also gave some numbers, some statistics. So the follow-up question I'm going to have is, do the statistics on who is served by our local programs parallel what we know about rates of incidence of the challenge? So do the statistics parallel?
Can you clarify your question a little bit more? I'm sorry.
I can. So do the statistics we have now reflect the people or the population that we serve?
So,
Local statistics. If you
right.
follow.
So if we look at actually, the local statistics and what is available as far as services, we do not have services that are parallel to the actual incidences that we're dealing with. So in particular, women in general have less opportunities for housing, shelter, any other of our basic bottom layer, Maslow's hierarchy of needs in the substance use disorder realm. So we have probably 30 male only, male identifying only recovery residences in the greater Allen County area. But for females, we only have, or female identifying, we only have maybe 5 places that women can go. And the places that they can go, often if they're not already full, they may not be able to take that individual because their funding is dependent on them serving somebody that has either had domestic violence, sexual assault, a child. So single women in the community that have substance use disorder have a very difficult time getting into treatment or getting into a recovery residence. So when we look at how does it match up for women in general, it doesn't match up very well. If we look at how it matches up for individuals who do not identify as a man or a woman, or they are fluid in their identity, we are gender expansive in all ways. When we look at these different populations, we have even less support for those individuals, and it is harder for them, even if they do get admitted to a facility or get accepted into a recovery residence, it's harder for them to stay there because of all of those different compounding factors with the populations that are also being served in that community. So if you can imagine, if I was a transgender male and I went into a men's shelter, I might experience a different level of discrimination than just a man going into a men's shelter, right? I'm going to have a lot more challenges with that scenario. That compounds if it's a female, that compounds if they don't have a child, that compounds if they have not experienced domestic violence. And that doesn't mean that we want people to have all of these extra compounding factors outside of what they're dealing with, but the more narrow we go with the population that we are addressing, the less likely they are to have those services available to them in our area, in Allen County. So that's one aspect of it, but then also a lot of what we hear from many of our partners, we do a lot of health disparity work within the community, and the partners that we hear from will tell us that we have certain populations that are not comfortable going into an all English speaking environment for treatment. So if there's not or if there's not a person in that house that speaks the same language as them, they're not necessarily going to go to that recovery residence. Their family doesn't want them to go. They don't want to go because they will be more isolated in that situation than not. So there's a lot of different factors with how diverse our population is in Allen County and how limited our service population is and our availability of services in Allen County. Does that make sense?
Yes.
And I think that speaks to how important it is for agencies to try to make sure that our staff reflect the community's population as well, because for someone who is in a difficult situation, whether that be domestic violence or addiction or sexual violence, and seeking out services, and then they don't see themselves represented by the people around them, by the staff, by the organization, then they're not going to feel as welcome. When you're already in a very scary situation, and then there's a language barrier and you can't talk to anybody without, oh, hold on, let's go call an interpreter so that we can ask you what your question is. That creates a huge sense of isolation. And then, as was spoken to with the other factors that might be present, even though we are seeing with the population of clients that we are serving, we're seeing a very diverse population. While we might be able to provide certain services to them, as we're trying to meet all of their needs, we see tons of barriers come up, where maybe we are able to house that trans individual, but then to get them into stable housing, because we're just a shelter, so we can't be their house forever, what are the options for a transitional program? Or when you are trying to find employment and there are immigration barriers, and for anyone who knows anything about the immigration system, it is not a quick process to help someone to get lawful immigration status. And so for the next year or more, while they don't have legal documentation, how are they going to get their basic needs met? So there are a lot of extra barriers that even if we can get them in the door, to then be connecting with all the other resources or new challenges that will come up along the way that can create more barriers for them.
Great conversation. So, we got all of these statistics. We know all of these things. What are our programs doing to accommodate or to help with some of the overcoming barriers for the clients that we serve? I'm just going to kick it off, Nunu. What are some of the things that we're doing to overcome?
So first thing is we have to share what does mean domestic violence, because of immigrant population, they don't know they have been victim. So my expectation, and I respect their religion, their culturally, and their expectation, which means that is sometimes some religion the leaders control, then they abuse and their relation. So I have to explain what does mean abuse, because of their control. Domestic violence is come from the control and power and control. So they have to understand what does mean abuse, and they need to give all resources in the community. So that's why I have to start looking and giving education and sharing all resources, and then tell them to keep them that not acceptable. It's a power and control. That's not acceptable. That's why they have to know that what does mean abuse. So I have to share with a lot of education to the community, so they can get some services if they are a victim. So, and then they recognize that they are a victim of domestic violence. So most of immigrant population, they think physical abuse is only a domestic violence. So I have to share what types of abuse. So what is it control and power and control? So, and then I have to build with trust. First thing, I have to meet with my client. I have to explain what is it confidential mean. Because of my professional, boundary and my personal boundary, because I'm a from this community. So I work at the community, and then they will come and ask me, hey, what do you do? What are you doing? So, sometimes I can explain what our services is, and also you can get resources from that place. But sometimes victims come to me and, hey, how are you doing? How do I tell them? So 2 or 3 community members look at me, oh, she got this. That's why she talked to this. So I am very struggle being between, my boundary and professional boundary and my personal boundary. But I will share as I can to get to know what does mean if abuse is and what does victim look like, how to affect their children, how to affect them, especially emotionally. So that's all I have to explain that. It is my question. That is
Yeah, so I think another thing that as a community, so DAC is not a direct services provider, Drug and Alcohol Consortium. Generally, we don't do the direct services. We partner with about 180 agencies throughout the community to provide services, to do technical assistance for grant making, to coordinate different groups. So our recovery residences meet once a month to talk about what gaps in services we have, how we can better kind of channel people to appropriate houses for them, to different treatment levels and that kind of thing. We also have that with our education system. We have programming in the schools that helps to do, like Nunu was talking about, we need to have that education from preschool up. We need to have education on what is power and control, who do we have power over, only ourselves, and if somebody else is taking control of us or taking power from us, then we essentially are in a state of imbalance. So we want to teach the youngest among us what it is to be out of balance with your own power and control over your own body and your own self. So that's part of the programming that we do to teach young people in the community. We partner with Fort Wayne Community Schools, and most 7th grade classrooms do a program called Project Alert. We partner with Boys and Girls Club and Powerhouse Youth Center in New Haven, and do programs called Too Good for Drugs and Violence. And there are other programs that we do in coordination with all of these different agencies that we work with to try and provide that education that Nunu's talking about, so that people can identify when some of their power has been taken from them, and how and why that's not okay, and then how we can then provide referrals to services that could maybe help them get to that point where they are receiving services. So that's one aspect of the work that I think our community in general is doing, and DAC kind of sits and we facilitate, but it's really the community that's doing this work. The other thing that is one of the pillars of what we are working with within our community is approaching things in a harm reduction manner, which means low barrier to treatment. So it is a little bit more of a balance of those boundaries, like Nunu's talking about. So you have to actually give a little of yourself to let somebody else in so that they feel comfortable to share or to ask for help or to seek, a referral for something. So we want to make sure that we are decreasing the power and control aspect of us as providers and handing that power to the individuals in the community that are seeking services with us. One of the ways that we do harm reduction is by empowering individuals who are in recovery themselves to become peers to individuals trying to get into recovery or who are on that ambivalent spectrum where they are ready maybe to get some help, but they still need somebody that has an ear. They're not quite there yet, but they're considering that help. So we do a lot of peer recovery coach training, and we do different programs that empower the individuals that have come through a good portion of their journey so that they can help others and coach them through getting to that portion of their journey. So using peers throughout the community, using techniques specifically related to harm reduction services, and then also looking to develop resources that we identify as a result of assessing our community. So one of the biggest issues that we have come across since the beginning of my time at DEC for sure, but I'm sure well before that, was that we do not have a lot of resources for LGBTQIA plus youth. So one of the things that we did in this last year was apply for funding to open a community-driven LGBTQIA plus youth drop-in center, and we're calling it the Brave Center. And I'm going to test myself by telling you what all those letters mean, but it stands for Building Radically. What's the A? It's not accepting. Affirming, sorry, and validating environments. So in doing that, we are looking at a drop-in center, but in addition to the drop-in center, we are doing research with Fort Wayne Medical Education Program, which is a physician and nurse practitioner residency program in town. And we are doing research to figure out where our professionals within the community are with their knowledge of affirming care and their willingness to perform affirming care. So gender affirming care, just so you know, is what I'm talking about when I say affirming, and that means if I identify as gender expansive, meaning I don't always identify as, female, I don't always identify as male, it's not a binary thing, I'm just somewhere in that spectrum, and I go to my doctor, how can my doctor best serve me without pushing me away? So we are going to be doing a lot of work with the medical community and the mental health community to help them to identify where they are, and if they are willing to be an ally to this program, then we will put together, based on what our community deems to be the needs or where they have a lack in or gap in knowledge or services, then those professionals can become certified through our program, and then those individuals that have become Brave Center certified individuals, which is not the technical term yet, I don't know what's called, but that's just the general term. Once they get to that point, those professionals in the community, so medical and mental health professionals, and then, social workers and everybody really within the community, at that point, we have a broader resource set for the individuals in our community that currently do not have affirming care. It is over 90% of individuals that are gender expansive that do not feel like they can go to their doctor with an issue if that issue is related to the gender that they were assigned at birth and not necessarily who they identify as a person, as a human being. So that's extremely difficult. So just for an example, just so that we can kind of make sense of what I just said, if I am a passing, which means I look as though I am, right, to other people, to the general public, if I am a passing transgender male and I am having issues with my uterus because I have a uterus, and I don't feel comfortable going to my doctor to talk to them about that, or I don't feel comfortable going to an OBGYN's office, or I don't feel comfortable even talking to my social worker about it, that is a problem because that manifests into other issues, right? So we're looking to do that with this Brave Center as well. The other things that our different community members are putting together to work with is having an all Spanish-speaking recovery residence. That's one of the things that we are looking to have. A couple of our partners have had some graduates that were only Spanish-speaking that have come all the way through their programs. It was a struggle, and the families were very appreciative, but at the same time, we saw a lot of flaws in that process. So we call it our intervention committee. So our intervention and treatment committee put together some plans and did some assessment of the community through our overdose fatality reviews, because we do a lot of studies on overdose. And what was determined is that we need residences that have first language Spanish speakers, but also our other cultures that we have in our community too. So it would be great if we could have our Burmese, all Burmese, but we have a lot of languages, obviously, so we have to look at, what that looks like for that population. But the point is that it needs to be driven by the community itself. So we can facilitate the conversation, but I am not a transgendered male Burmese substance use disordered individual that needs services, right? So it doesn't need to come from me. I'm not the person for that to come from. I can help facilitate that conversation, though, and that's what we're trying to do. So there's a lot of different ways that I think our community organizations are putting forth that effort and coming to the table and talking about what's going on in the different communities that are served, and as community members themselves to move forward with what we need to do to support each other in this community.
Thank you. Anybody else want to expound on what the YWCA is doing?
I'll just go quickly and briefly over the YWCA and our organization as a whole. This dialogue here today is an example of some of our efforts to increase awareness and these disparities and continue to work towards equity in our community in these areas. We also internally have the same efforts going on with our training efforts, so that the members of our organization are equipped to work with the populations that we serve and take a very person-centered approach to that. As I speak as the director of residential services, in our residential services, we do work towards inclusivity, and we do try to provide the environment that's conducive to being as much home-like as possible. When people are displaced, we want to be able to welcome them in, have an understanding of what their cultural needs are. So it's food, any of that, medical needs, different practices, things like that. We're going to try to approach accommodating that so that they feel as comfortable as possible. There are, again, barriers, challenges, things of that nature. Again, with that, we also, the LGBTQ community, we house people and serve them as they identify, and we, again, in an effort to continue that and promote that inclusivity and ensure that all of our community members are able to access our services. So those are some of the ways. Again, like I said, this is something that our diversity dialogues and other community-based efforts are in conjunction with us trying to create that awareness within the within the community and other agencies, and bringing that to the table as we also work to collaborate with them to assist the clientele within our community with overcoming the many barriers that I think you spoke to earlier as we're facing and dealing with them and helping them overcome the adverse experiences they may have had. So I'll let Jennifer talk about.
I just want to jump in real quick. I just want to say that one thing that we appreciate as being a community organization that works with all these different organizations is that sometimes we also know that it's just not within our scope to serve an individual. So I think sometimes when we do have somebody that does not we can be as inclusive as we possibly can in every situation, but there are some times that we are not the right person to serve or to speak for our population, and at times we need to step back and say, I need a referral from another organization. And part of that community building and having all of these different places at the table is that they can say, hey, we've had success with this particular outcome for this particular population. If you're struggling with that, let's talk about it, so that you can better serve, or also maybe so that if you don't feel comfortable, or if it doesn't work within your community, or that person does not feel comfortable, that you have some other options for them. Because also every organization has their different rules and regulations about what behavioral issues they will withstand, what kinds of abuse the staff is willing to take, you know what I mean? And I think that that's not appropriate. I don't think that any staff should take abuse, but let's just be real. People have a lot of trauma, and there's a lot of trauma and there's a lot of guardedness that we are dealing with in everyday conversations with individuals. So having the know-how and the knowledge to make referrals when appropriate is also something that we really kind of stand on with this kind of community engagement aspect of the work that we all do.
Sorry. I was going to speak a little bit in our sexual violence programs when working with clients, and this is true for our domestic violence programs as well. Part of my favorite part about programming is at the end of the day, every choice is left up to the client. We give them power back, something that they have been missing for a really long time. And so sometimes we might make a suggestion of, hey, I think therapy could be a really good fit for you. At the end of the day, if the client doesn't agree, they have the autonomy to make their own decisions. And that's also, I think, really important to highlight in our sexual violence programming. I know I was talking earlier about the criminal justice system and how we ask survivors frequently to engage with the criminal justice system. In our programming, that is completely optional. We will still provide services for you, whether you want to move forward with charges or not. If you want to have a sexual assault exam, we will take you over to our friends at the Sexual Assault Treatment Center. But also, if you don't want to have an exam, or maybe you aren't within the window of time, we will still provide those services for you. And then for survivors who do choose to interact with that criminal justice system, we're going to be there every single step of the way. We're going to go to every interview with you. We're going to sit with you in trial. We're going to go with you when you make your statement. We'll drive you to the Sexual Assault Treatment Center, wait there, and then drive you back if you need it. So we really try to be hands-on with the clients, but we leave the options up to them. And then I also just wanted to highlight, we're talking a lot about the intersectionality of risk, meaning multiple barriers, right? So I just wanted to touch, I know we shared a lot of statistics on intersectionality within drug usage and recovery and those types of things. So in the sexual violence world, nearly 50% of all LGBTQIA plus people are sexually assaulted at some point in their life. People with a disability are 3 times more likely to be sexually assaulted in their life. And 50% of transgender people report experiencing sexual violence somewhere in their life. So I think that's important to remember, because every risk factor you have, your probability increases. There was a 2015 United States transgender survey, and of all, in that report, it was reported that 53% of Black people experience sexual assault sometime in their life. And if you remember from our earlier statistic, when we were taking a national survey of everyone, that was 19% of Black women specifically. So that intersectionality piece is really important, because it changes the statistics a lot, and we're talking about that a lot right now. So I just wanted to recognize that as well.
And then with the question of what are we trying to do to address some of the disparities, I think for our domestic violence services, our role is to be advocates. So trying to help make sure the voices of our clients are being heard. So when we have a non-English speaking client who is trying to make a police report and their child is being used to interpret the domestic violence just occurred between the 2 parents, we are advocating that an appropriate interpreter needs to be present to make sure an accurate report is being made. When we see that our clients' request for a protective order is being denied, how can we try to help them formulate that narrative of what happened so that they have a better chance of having that be approved? When we are seeing that our client is experiencing medical complications, and when they're going to the doctor, their doctor is dismissing their symptoms and saying that they are just trying to get more painkillers. We are advocating on their behalf that their symptoms are real and valid. And so our role as advocates is to, one, help make sure our clients' voices are being heard, but then also help them get that power back so that they can start to make choices for themselves, so they can start to speak for themselves, because that's been taken away throughout the abuse they've experienced, but also the way the system then, unfortunately, will continue that abuse as they try to get help. So trying to do that with the different populations that we are serving when there are additional barriers that are going to make it harder for their voices to be heard.
Well, this is going to be the last question before we open it up for question and answers. For those that are online, if you have any questions, just drop them in the chat and somebody will bring them up or speak on your behalf. So we talked a little bit about intersectionality. We talked a little bit about the services that each organization provide. Let's talk for the last question. How, as a community, whether you serve in social services or not, how can, as a community, can we support all our organizations who work with the least and the less and the marginalized people? I'm going to speak for somebody who works in residential shelter. I love our donors, and I'm sure a lot of people love donors. But I think at some point we also have to understand who and what they are bringing. So, for example, if our population is a lot of minority population, what do they like? What shampoo? What conditioner? What reminds them of home? What deodorant? What things that you guys provide will help them be able to overcome barriers? And so those are some of the conversations that, as organizations, that we can have, making sure that you're intentional, or people are intentional with their donations, if that makes sense. So, like, as a minority woman, I don't use VO5. So sometimes, VO5 shampoo and conditioner doesn't work for our clients or work for some of the population. So just being intentional in partnering with other community organizations who may not work in social services. I'll kick it off, Emma, because you got
I got excited for this one. I came ready for this one. Okay, so as a community, the three things I kind of always highlight, I think that can be done more in sexual violence specifically, first and foremost is bystander intervention. If you are at a bar and you notice someone looks uncomfortable, go talk to them. If you are at a party, go talk to them. So frequently, survivors say, if only one person would have stopped and asked me if I was okay, or asked me if I had a safe way home that night, it could have prevented what happened. So I really kind of urge the public. I know it can be uncomfortable, but you never know when you're going to be hitting that one person that really needs it. Secondly, it's our responsibility to know our resources. You never know when your friend is going to come to you and disclose that they were assaulted last night. You never know when you're going to meet somebody at a coffee shop and have a conversation with them and they're going to disclose something to you. Sexual violence survivors oftentimes disclose very kind of irrationally. There's no pattern to it. Survivors frequently are scared to tell their loved ones. They don't want to tell their parents or their friends or their teachers for fear of judgment and shame and guilt. So sometimes they are disclosing to a random stranger. So it's your responsibility to know the resources. Be able to say, hey, check out the Sexual Assault Treatment Center. Hey, go to the YWCA. They have advocacy services. Just being able to put them in contact with somebody is a huge help. And then lastly, getting out and voting is huge. A lot of the issues we're talking about today are systemic issues that can begin to change if we're changing the legislation and the policy surrounding it. Right now, the General Assembly is 76% male and 89% Caucasian. I want an assembly that looks more like our public. I want more women in there. I want more black people in there. I want more representation. And the way that we do that is by going out and voting, because they are who has the power at the end of the day to change this policy and legislation. So if you're not already registered to vote, please go register. Our next election is coming up very soon. So just get out there and use your voice, because it's the biggest gift you've got.
I'm gonna go right after that. November 8th is that day. It is a Tuesday every year, just so you know, every time we do voting. Voting in every election is important, not just voting in the presidential election. It happens every 4 years, every November. We want you out there voting how you want to be treated and how you want your neighbors to be treated. Making sure that young people are registered to vote and that they have not lost all hope for our democracy and our communities, right? We need to make sure that people know that there is a power in voting and not to diminish the efforts of everybody that has been going out there and kicking A and taking names. I behaved. Like, we want to make sure that everybody that is voting, we're very happy you're voting. We want you to continue voting. We want to make sure that we are actually represented in those numbers at the polls. We are not represented in our Indiana State House at all. Not a single person in this room, literally. Well, maybe some of those guys, but nobody's represented down at our State House right now, okay? So that's really important. I cannot say enough how absolutely correct you are. We got to get out there and we got to vote. Do you want me to talk about my other ideas, or do you want somebody else to talk first? Because I just talk a lot. Okay, we'll go there. Sit on a committee. Sit on these committees that we have. We have so many different committees that are addressing different issues that we're having in our community. If you have some perspective on that, sit on one of our committees. We are begging people from the community to sit on our committees. We have a 12-sector committee that is 12 different sectors of the community that we want to be addressing youth, alcohol, and substance use. Ask us about it and sit on our community. Jump on our website, dacac.org. Support us by following and liking and reading our posts on social media. A lot of our posts have a lot of words. A lot of our people that are putting posts up for our organization got a lot to say. We want you to hear it. It's all good information. It helps you with your own children if you have them. It helps you with your parents if your parents are experiencing any kind of substance use disorder or anything of that nature. It helps with, we have a lot of different anti-racism aspects to what we're throwing out there on our social media. Follow our social media pages and make sure that you know what is going on in the community and what committees are out there for you to get on. Also, make sure that you're educating yourself on your own bias. Make sure that you know what your biases are, and please, by all means, do that on your own and educate yourself, and do not put that burden on the individual that is oppressed to tell you how you are oppressing them. So do your homework and look for the ways that you can reduce stigma in our community, and whether that's regarding substance use disorder, anything related to LGBTQIA plus community, to our populations of color, to our indigenous individuals. Do not ask the individual, please, how they can educate you on how you are oppressing them. That is a cyclical trauma issue that is really hurting the individuals that we're doing that to. So please take that into consideration. And then also, we want to use person-first language. We're not going to be perfect every time, and sometimes we're going to say addicted person, but we really want to say person with an addiction. Or even better, we want to say person who has a substance use disorder, because that person is a human being and a person first, and whatever else is going on with them is a part of them. It is not who they are. So making sure that we use those words appropriately by putting that person first when we're talking to them. So those were my ways that you can help our organization. Also, of course, donate to the organizations that you care about. Donate to the people in politics that you know are on point with what you believe and how you feel about things.
Anyone else want to say anything before we open up the floor for questions?
I think just to add to what was saying about the educating yourself, it's so important that we are educating ourselves on how these disparities are affecting people other than ourselves. So if myself as a white woman, maybe that policy doesn't hurt me, but if it is hurting our community, hurting the populations that we are serving, then we need to be active in voicing those concerns and helping see what those barriers are so we can overcome them. If we are just okay with the status quo because that's what it is and it's a little too icky feeling to try to address it, then we're part of the problem. So we need, if we have a platform, if we have a voice, we need to be using that platform and voice to try to make change, and don't be okay with something just because it's easy. We need to do the hard work to try to make things better for everybody.
Do we have any questions? We have a microphone in the middle, but if you feel like your voice is loud enough, you don't need a microphone, you can speak up louder.
I'll just encourage everyone to come to the microphone because we have more participants online and they'll be able to hear and see if you come up here. And I also want to just highlight that some of our information is available at the back, as well as the Sexual Assault Treatment Center was kind enough to bring information to share about their services today. So I just wanted to make those announcements, and I hope people will add to the discussion. I know we have a variety of different agencies and people here, so add your voice today if you would.
Do you guys have a resource list, like a large resource list that is easily accessible?
So there's a couple different places you can go for those resources. If you are looking for general resources, housing, food, shelter, for the general population, going to 211 is one of the steps that you can take, but also going to lookupindiana.org and putting in your zip code. Lookupindiana.org focuses more on mental health and substance use disorder. That's something that the Lutheran Foundation here in town does, and they do a beautiful job. They have a wonderful agency that does the website for them, and they are so gracious about updates that we need to put in when something has changed, when an address to an organization has changed, or when the contact person has changed, that kind of thing. So they're very good about just, you can send them an email and say this has changed. Once your information is in there, if you are another community organization, they will email you once a year to see if that information has changed. Please don't ignore that email. It's important that that information is up to date. But you can go to those two specific places to find the big kind of host of different organizations that are served. I know that the Y has tons of resources on their website. On our website, we have any partner that we work with. We have the information about what services they provide on our website. That's actually an avenue for us to feed it right into lookupindiana.org. So.
And I'm sorry, can you say your guys' website again?
Sure. It's I'll say the words so that you know what I'm saying. Drug and Alcohol Consortium, Allen County. So it's D as in dog, A as in apple, C as in cat, A as in apple, C as in cat, .org.
For sexual violence resources, we recently had a new kind of project started here in Fort Wayne called No Matter What Fort Wayne. You'll be seeing these around the city. There was a survey done of all the women in Fort Wayne, and one of the needs that was highlighted was a lot of people didn't know where to go if they've experienced a sexual assault, who to call, what to do. So you can go to nomatterwhatfw.org. And a lot of our organizations, the Sexual Assault Treatment Center, the YWCA, I know the Center for Nonviolence is on there, a few other resources that if you've experienced sexual assault, sex trafficking, childhood sexual abuse, any of those forms of sexual violence, you can go on this website and find different types of resources, locate which one you think is best for you right now, and then get connected with one of those. And then I know us as agencies are always giving referrals to one another as well. So hopefully you're seeing these around the community. If you see it, there's a little QR code on it. You just scan it and it'll take you immediately to the website. So if you guys are experiencing any survivors, this is a great resource to help get them pointed in the right direction.
Also, I'd be remiss if I didn't note that 988 is our new mental health suicide hotline for the entire nation. So from any cell phone, any landline, you can call 988 and you can get services right away on the phone for somebody that is experiencing that need.
Sorry. Earlier you guys were talking about the lack of support for women in general, and then very specifically single women with no kids and other factors. Are there efforts that you guys, the organizations you're working for, to increase the availability of shelters and services?
Yes, actually, one of the great things that has happened recently in our community is that has happened. We have had some new organizations that were formed by a lot of women that were in either Leadership Fort Wayne or other organizations that are coming together. There's some place called St. Joe Mission or something of that nature that I had a friend of that was involved with. And we are working with other organizations to expand their availability of beds for differently challenged individuals. So if it means we go for a Department of Mental Health and Addictions grant that can, provide 3 beds at the Y for a very specific population, that it can support those clients that are not covered by their other grants. That's another thing that we do to coordinate those services. So.
And when it comes to our domestic violence and sexual violence services, YWCA provides, we have our 24/7 hotline, we have our emergency shelter, our community-based advocacy services, and therapy services for anyone in our community that is experiencing domestic or sexual violence. So any race, gender, gender nonconforming, any age. And so we can provide those services. But we also, as an agency, we need support from the community because I would be, sugarcoating if I said it's not free to do this stuff. It has a real cost. So providing shelter to the hundreds of people we provide shelter to every year who are fleeing domestic violence, it has a very real cost. Having advocates who provide comprehensive support in 6 counties has a very real cost. And so we need that support from our community so we can continue to do what we're doing, but also we can do more because we have not even reached the tip of the iceberg of the folks who need our supports. But we need more staff to be able to continue to meet that higher level of need and demand.
We 4 work at Just Neighbors, so homeless shelter for families, and we also have an eviction intervention program. So this question is kind of for both programs. One is trying to reach the populations that may not speak English, may not go to the places that, the standard info, may not be able to call 211, et cetera. How can we connect with them to get our info to them? I mean, I can go through Catholic Charities for the Burmese population, but
a lot of we don't see a lot of the English as a second language population coming to us for assistance because they don't know that it's available for them, or they don't know who they can communicate to get that kind of assistance. So if we need someone to more or less like help navigate them through that process, or to at the very least translate them through that process if they are facing eviction with us, who can we talk to?
So I think a big part of it is building up those community relationships of who are our partners in the community that are serving that population. So if you have a service that you are wanting to provide, but you are not, you don't have all of those resources to provide the language that is needed, or are not as culturally competent in what those needs are, then it's partnering with organizations that do. And so whether it be participating, we have a lot of community meetings that you can go to, the Multicultural Council, Latinx, different diversity-focused entities that get together to talk about what are the needs of this specific population and how are we serving that in this community. So being present at those meetings so that you can connect with other service providers. Making sure you are providing interpretation services. Language Services Network is a local organization that can provide interpretation and translation services for you. So contracting with Language Services Network to provide that interpretation so that proper language services are being provided. There's also various over-the-phone interpretation services that you can contract with to make sure that you're getting proper interpretation to talk about whatever it is that you are communicating with them about. But also building those partnerships with organizations that serve that population so that that client can have other supports. So partnering with the Center for Nonviolence for their Latinx support or their LGBTQ youth support. Partnering with Amani Family Services that serve a large refugee and immigrant population. Looking to some of those organizations so that not only are the specific reason you're needing to address that client getting met, but also they're getting their other needs met as well.
So there's no specific organization that works with all these, because for us, we can't call 7 places to see if they can offer what we need. So there's no one particular organization that says this agency can do this part.
If it's a language barrier issue, you probably should go through Amani Family Services. Right. So that's your one, point of contact that you could use for that. But also for the 211 and the lookupindiana.org, they all have the translation services. Now, they're not perfect, but they do have the translation services where they are across the board, pretty much any language you can think of that it gets better every time we use it, right? Because people can help correct that, just like Wikipedia. It's the same thing when we do that with any of our Google searchers or going into those organizational pages like 211 or lookupindiana.org.
So if I want to get info to people, not necessarily language services, because we know how to do that. If I need to get info to people to know if they need the services to call us, there's no one place that kind of works with all the different organizations that can then relay it to who it needs to get to.
I think she's got an answer for your question.
Okay.
So one of our local organizations that is absolutely amazing is Connect Allen County in the FSSA building. They do have they do have a Burmese advocate as well as a Spanish-speaking advocate. So if you're looking for services, connecting them with that organization would be a really good start. And making sure that those types of places know that you exist and that you're willing to do those things.
And
So it's not so much getting someone to interpret for me. It's
getting the
info to
information
that
out.
population,
Right.
so they know to reach out to us.
Yeah.
Would that be the same?
Yeah, I would just let the organizations like look up, know that you're interested, Allen County Connect, and
we work with those
making sure that they
So
know.
my suggestion would be every poster that you have, you need a Spanish version and you need a Burmese version, minimum, for Indiana, for Fort Wayne. So create kind of your English-speaking version, and then there are interpretation services that has helped. If you have native speaking at all on your staff have helped. There's different places you can go to get those translations, but get those translated and then put them in, yes, where you have your English posters, your posters in the English language, but also find places where the Latin community is congregating and make sure that you have your posters in Spanish available in those locations.
And that's where connecting and having true collaboration with other agencies, so that if they're serving that population, they are then knowing that they can refer clients to you that are in need of your services. And honestly, when you're talking about the immigrant and refugee population, so much is word of mouth and being integrated into that community. And so like Emma was saying, how can you be in rooms where you can have that true collaborative conversation and build those relationships?
I'm on the multicultural council. I mean, I'm connected to those services. I was just hoping there was something I wasn't aware of that would solve the problem for me.
There's definitely not a one-stop shop, but I would also say one of the biggest things I would encourage you to do is ask people from that community to sit on your committees, to sit on your board of directors, so that they can then take that information back to the community that is maybe needing the service that you aren't being able to reach.
Another question I have is a warm handoff, because when people are in trauma, if we just say here's a phone number to call, because we do referrals, and referrals are great if it's a standard thing, but if it's somebody who's experienced a trauma, we don't want to say here's a phone number to call.
Right.
So is there a way to do warm handoffs to your programming that would take down that barrier for them so they don't have
Give me 1 second, because they're not hearing the questions. So let me repeat the questions. No, you're okay. They're not hearing them online. The question was, how can organizations better do warm handoffs, so clients to different organizations?
So I can say at the YWCA, if I have a survivor come in who's already working with another advocate, case manager, something of that influence, I'm going to invite that advocate to come to at least the first, if not the first 2 or 3 meetings with them, because you already have that trust and rapport built. So then if the client can see that there's trust and rapport there, but then there's trust and rapport between the 2 of us as professionals, it's going to make that transition go more smoothly. So I can only speak kind of from the YWCA perspective, but I know if someone already has another support, we are welcoming that support to the table once we have a consent to release on file.
I think another thing that's important to know about just that relationship that we need to have with everybody for that warm handoff is never give somebody just a phone number. You know that, you're obviously saying that, but don't give somebody just a phone number. Actually sit down with them to make that call. And if you know somebody at that organization, call that person directly. So the more we attend these events, the more that we know people. You all know me now. My name is Mary Claire. I'm downtown right by Starbucks. We're getting a mural in our building. Super excited about it. Come see us. Drop in. We literally have like 8 different meetings a month that you can pop into. And these are meetings that are community organization meetings for people coming together. If you came to one intervention committee meeting, I guarantee you'd have 15 to 20 people that would then communicate your services back out into the community, and that you could then call when you need a service from them. So that part of the warm handoff is so important. And I appreciate you can't go to every meeting, you can't be every place. But if you call me and say, I need somebody to get into treatment right now, your warm to me is my warm to these 3 people that I trust. So that kind of collaborating is, I think, what is the most important part of our relationship building as organizations, is that you now know Mary Claire at Allen County Drug and Alcohol Consortium, and Mary Claire can tell you, I'm busy as heck right now, so I'm gonna have you talk to Monique, but I promise she's gonna take care of you too. So keeping that kind of friendly conversation going, please don't ever hesitate to call us if you have a question about any of our partners, because we will help you get connected with them, or we'll connect you with a partner that does the work for you and helps them get what they need.
So I'm going to speak about the Fort Wayne Sexual Assault Treatment Center and that warm handoff. So if you have somebody who's disclosing to you and seeking out services, we will talk directly with that victim survivor. So even you call our number, you'll be connected immediately with one of the nurses, and we're going to explain what the options are, because so many people don't even know that they even have options in the state of Indiana. So certainly anonymous reporting is an option. Again, if you're 18 and older, full team, we'll explain that. And of course, we work so collaboratively with just about everybody sitting up there on that panel. So yeah, there is a warm voice human being at the end of the line, and always our nurses are going to explain what those options are for kiddos. We all, certainly Department of Child Services, I mean, that's really something, and then they'll get in contact with us. So we do have a pretty good system in place whenever the issue of sexual violence and child molestation does come up in Allen County and the surrounding counties too. So
Yeah, and I will say the Sexual Assault Treatment Center, their nurses are incredible. A sexual assault exam is never a fun thing to do, but they make you feel so welcome. I've had survivors before who have been like, my nurse made me laugh during my exam. I don't even know how that happened. So just kudos to you guys in the service you're providing.
I also want to thank you for bringing up the warm handoff in that, because creating that additional connection piece and support can help create that lasting stability and lasting breaking down of those barriers for the populations that we serve. And it is very important so that we can decrease them re-experiencing some of the things that they're experiencing, be it.
And they're not the 700th client that I went through this with. They're,
Right.
Shirley, and she has a story, and they
Absolutely.
each need to be treated. And I always worry about that when I refer someone to another organization, because I don't want them just to be 1,000 callers, and I want them to feel that same, humanization that they deserve to feel, especially when I'm referring them to somewhere, because I'm telling them this person's going to take care of you. And for that not to happen, that comes back on me, and I feel like I'm not doing my job for my client.
And they're more apt to receive that service, but also more apt to remember that experience.
Yes.
And
refer other people.
Exactly. And also refer back to it, and that can be helpful in preventing future crises. So.
Yes.
Well, thank you guys. This was some great conversation. Of course, we didn't solve the world problem today, but we had some great conversations. I just have a few closing announcements. Save the date for our second annual Race Against Racism 5K Walk Run, which will be Saturday, April the 29th, 2023. If you experienced it last year, come out and experience it this year. It's a great event. Also, if you did not sign up in the back, we do have certificates for those for CEUs if you need those certificates. And I just want to leave us with a little reminder. It's not a they problem. It's not a my problem. It's a community problem. And so warm hands and community collaboration is what our clients need best of the population that we serve. So thank you again for joining the YWCA.